just going to hand over to Kenji Shibuya, who is going to do the closing statement. And of course, Kenji well, he has now been in post, I think, for a little over a year now, heading up the Institute of Population Health at King's. And senior advisor to the Director General of the World Health Organization in his previous sort of roles as well. So he's going to make a few comments. I just want to point out there's clearly the prevention message has come through loud and clear throughout this conference, but I know there's a tension that perhaps Kenji can speak to. In that the swing to prevention versus cure is great, but what concerns me is that this will simply translate to diet and exercise initiatives rather than supporting more ambitious research that targets the aging process directly. Will governments also be committing funds to breakthroughs in new therapies against aging? That speaks to a few other comments about treating aging as a disease and the balance between how we view the aging process and all the science and technology that's elucidating this. So I'll just leave that with you, Kenji, perhaps just to comment on that. But I'll hand over to you, and if there's time, we may have a question or two, and I'll make closing statements. Over to you, Kenji.
Thanks very much, Nia. I'm Kenji. So our institute aims to enhance interdisciplinary approach to the most pressing population health agenda, both locally and globally. So obviously, King's Institute of Population Health aims to look at more on aging and COVID-19. The first, I'd like to congratulate Tina, Richard, and Dimitri, and our organizer, and of course, the distinguished guest for a series of stimulating discussion debates across the world. So now we are in the middle of the second wave, and we have focused on the challenges in policy and governance on longevity in the midst of COVID-19. So as Robert and others articulate as the debate, the COVID-19 has posed sector-wide challenges and revealed the fundamental inequality in the social and healthcare system, and more broadly, inequalities in the human security agenda. And they are aggravated by COVID, but have been hidden or overlooked. COVID-19 is not a crisis about health, it is something much worse. And Richard Horton of the Lancet called it a syndemic. A syndemic or synergistic epidemic refers to the idea that the virus doesn't act in isolation. He said focusing on the virus alone is a mistake, and deadly impact of the pandemic is not caused by the virus acting alone, but interacting with chronic disease like diabetes, obesity, heart condition, and blood pressure, or against the background of inequality and poverty. So we can't fully control the infection without addressing those factors as discussed by many participants. And even if a hope for effective vaccine is emerging, it is still a long way to go for the world to go back to normal. So as Barry Bloom of Harvard mentioned when he was asked when the vaccine becomes available, he wrote in the New England Journal recently, "We will have a safe and effective COVID-19 vaccine when the research studies, engagement processes, communication, and education effort undertaken during the clinical trial stage have built trust and result in vaccination. Recommendations being understood, supported, and accepted by the vast majority of the public, priority and non-priority groups alike." So this tells not just vaccine, but something about longevity agenda here. Technology and policy alone does not change much, but we need community-driven, bottom-up approach to enhancing shared values and harnessing trust in longevity agenda. So if we look back, despite repeated message from WHO and Asia on the risk of COVID-19, and in January this year, the action taken by European countries, and particularly the United States, was surprisingly slow. And people might ask who was responsible for this pandemic that infected over 50 million people and killed over 1.2 million. Is it WHO, or China, or national government? Yeah, obviously there has been a political antipathy to globalism and also a decade of austerity created by conditions for politicians and the general public to look inwards. But personally, the most important reason for the widespread complacency across much of the Northern Hemisphere, except East Asia and Asian Pacific, was that political leaders underestimated the risk of COVID-19. So this underestimation or complacency is our common enemy, which is also applicable to aging agenda. That is slowly but steadily spreading across the globe. So this is why I have been working with colleagues across the globe to run lessons from a series of comparative studies. So one example, which we just published in the Lancet, on the lessons learned from exit strategy for the first wave. So we found that what matters is fivefold: trust, the clear communication, scientific innovation and technology, including test, trace, isolate, as in South Korea, a resilient public health system, and a long-term strategy, all of which are consistent with issues which we discussed today. So we need them for resilient system and system transformation for longevity as well. So COVID is a syndemic and a major challenge to humanity. And the human security approach are the fundamental value in the Japanese foreign policy, which we advocated. That prioritize protecting human lives is really pivotal in its response to COVID-19 in the aging society. And this is also my key message, that it is really time to restore global collective action, solidarity, and humanity in a global health governance to tackle COVID-19. So thank you very much.
Thank you so much, Kenji. Fantastic closing to an incredible three hours of presentations, insights coming from around the world. And I think, sadly, we're running out of time, so we won't really have much time, or any time, in fact, for questions. But I'll just very quickly pick up on a few of the key points. And in a way, we're going back full circle to where Sir Robert actually started when he opened up the keynote. This whole notion of a One Health agenda, this whole notion of health promotion and prevention being such a focus for the future that we must just get right. The need to have more resilient healthcare systems, and Kenji, you just spoke to trust and community there. And I think, the country presentations, and of course, which are so interesting. Japan, of course, they talked, our presentation from Japan, they talked about the sustainable economy needing healthy, active adults. And of course, His Excellence Dr. Alamiri spoke to the increased burden of non-communicable diseases. We've had the chronic disease epidemic, really, that needs to be wrestled with, and their efforts at tackling, for example, childhood obesity in the United Arab Emirates is laudable. And of course, they're very, very using technology in a big way. Of course, in Canada, they may be a bit behind in terms of having a longevity strategy, but of course, they recognize the importance of collaboration and networks, and the role also of technology and digital determinants was mentioned. And of course, on the European stage, the fact that, this new research in biomarkers, longevity research is hitting the consumer. And of course, the question that came through on the chat line, well, let's just make sure we are able to provide access to all those new technologies for everyone, and not just those who can pay for them. And finally, of course, Jeff Filkin, spoke to the need of the optimism, that while we have very, very serious challenges, there's a lot that we can do. And I think this message around collaboration and learning and doing what we can at a point in time when the mood and where we see COVID as an accelerant for sort of the systemic change that Kenji just spoke to, and the public appetite and recognition that health is such an important societal asset that we must nurture and protect, is a good, I guess, sign moving forward. So thank you so much to everyone who participated. Thank you so much for all the questions and such a rich discussion. We will make sure that all these insights, the questions, we will come back with the slides and a write-up of some of the key points. So with that, I will officially close, because we did promise that we would end promptly. And I just want to thank everyone who participated today. It was an absolutely phenomenal discussion and gathering of people from around the world.